Okay. Bismillah Rahman Rahim. Rabbi Shali Sadri Vaisirli Amri Waludatam Lisani Yafko Kali Sadakallah Azim. I am very thankful to all of you for joining, and I am also sorry for the delay in this lecture because for the last couple of weeks I was very busy. अच्छा इसमें ये जो बीच में एडमिट करने वाले होते हैं कासम आप उसको एडमिट किया करें चलो हो जाएगा ठीक है so we have to cover few topics. One is communication skill in clinical setting. Then we have to talk about counseling, and then crisis intervention, conflict resolution, and information care. So as you know, this is important because this lecture is based on many important areas for good clinical practice. So this was the link that was generated. The objective and the agenda of this is to recognize the common words related to communication, communicator role, apply key communication step to examples from day-to-day practice, and develop a personal communication resource for day-to-day practice. So why the communication role matters? Why it's important? It's important because it lead to increase increase accuracy, improve outcome of the care, that is physiological and psychological, heighten perception by patient that they are being supported by their physicians, and reduce rate of adverse event in medical errors. And it's better protection against complaints and malpractice claims. Communication skills are skills that can be readily defined, taught, and assessed. And communication skills need to be intentionally developed and refined as all essential clinical skills. It need to actively engage in the development of their communication skill via deliberated practice. So what is the role of communicator? As a communicator, physician from a relationship with patient and their families that facilitate the gathering and sharing of the essential information for effective healthcare in terms of diagnosis, similarly investigation and management. The key terms are number one, therapeutic relationship, patient-centered approach. That means previously it was like, for example, the teaching system is now student focused. Previously it was teacher focused, but now it is student focused. Similarly, previously it was therapist centered, but now it's patient centered. Then empathy. Empathy is basically to keep yourself at the place of the person, what he is feeling and what he is perceiving, as well as protecting your integrity. Then the common grounds, shared decision making, signposting and categorization, and chunking and checking, and safety net. These are all key terms we will be discussing them. The key feature of a good communicator are that it's interactive, it's dynamic, changing according to the situation, and responses. According to the responses, you have to change your way of communication. And then it reduces uncertainty, it's planned, it is purposeful, and welcome practice and feedback. These are all components that if you want to improve yourself, that you have to keep the feedback from the other persons. The verbal communication skill framework is providing a structure that is ongoing, building the relationship, and initiating the session, gathering information and physical examination, explanation and planning, and closing the session. So these are the 6 areas. First of all, providing structure, what we will do, and then developing a relationship or rapport. Rapport is RAPPORT. T is silent. And then initiating the symptom, and then gathering information, physical examination, explaining things and planning the management, and then closing the session. Hands-on patient-centeredness. Orient yourself to this patient and needs, as also known as patient-centered. So what is patient? AK is also known as. So patient-centered is you have to prepare yourself in such a way that orient yourself to the patient and their needs. Watch for signals and cues. Seek confirmation. Silence may not be agreement. Then barrier to communication. There are certain things which stop and disturb the communication. That is moralizing, arguing, preaching, and storytelling, and blocking communication. So these are all barriers. Moralization matlab usko tabligh nahi karni. You have to keep, it should not be one-way traffic. And then shuffling papers. For example, you are sitting and shuffling the papers. The person, you have to be prepared and very systemic, and not looking directly at someone when she or he is talking, looking out through the window or looking at your watch, that what's the time and you are in hurry. And if the office is dirty, then it's a barrier. And at the same time, I think if you are using very pungent type of clone or something, that can also be a problem. And then interruption and distraction. Usually the mobile phone is heavily a source of distraction. And you have to also be composed, and your clothes also matter. The communication skill is active listening, questioning, paraphrasing, focusing, challenging, summarizing, and working silence. These are all various communication skills. The written communication skill framework should have content, what is considered essential to be included, and then style, visual layout. You have to see how I've written. Isko panoramic view ya thairana nazar dalein. I will suggest that generally जो पहले इम्तिहान होते थे, अब तो BCQ MCQ का दौर है कि पेपर देख के उसको एक नजर देख तो लें कि मैंने लिखा क्या, बोलिया कैसा है. तो I've seen कि बड़ी बड़ी गलतियां निकल आ जाती. The communicator keys competencies. Physicians are able to establish professional therapeutic relationship. With patient and their family. This is very important in our culture and also other culture, that you have to look not only to the patient but also their accompanying person, particularly if you are examining a child, their parents must be there. Elicit and synthesize accuracy and relevance information, incorporate the perspective of the patient and their family, share healthcare information and plan with patient and their family. It's very important that you have to share information, and then you can say okay, you are having renal stone or you are having depression. The option are either you have to modify your lifestyle, either go for drug therapy, or you can go for TMS, transmagnetic stimulation, or go for ECT. So you have to give them choice. Engage patient and their families in developing plan that reflects the patient healthcare needs and goals. It should be according to the patient's need. Then document and share written and electronic information about the medical encounter to optimize clinical decision making, patient safety, confidentiality, and privacy. This is important. The competency one, communicators should physician are able to establish professional therapeutic relationship with patient and their family that can be in the form of communicate, use a patient-centered approach that encourage patient trust and autonomy, and that is characterized by empathy, respect, and compassion. Then optimizing the physical environment for the patient comfort, dignity, privacy, engagement, and safety. Recognize when the value, biases, or perspective of the patient's physician and their healthcare professional may have an impact on the quality of care and modify the approach to the patient accordingly. Then respond to the patient non-verbal behavior to enhance communication. For example, if patients dislike something, then you have to keep that in mind. Manage disagreement and emotionally charged conversation. You have to be very careful to manage your emotion, regulate your emotion, as well as having vigilant eye on the patient and emotion and appreciate them. And then adapt to unique needs and preference of each patient and to his or her clinical condition and circumstance. The second key competency is physicians are able to elicit and synthesize accurate and relevant information. Incorporate the perspective of the patient and their family. That can be divided into three. Use patient-centered interview. It should not be like filling the blanks. You have to keep a broader view so that accommodating the view of the patient. Provide clear structure and manage the flow of an entire patient encounter. And then seek and synthesize relevant information from other sources, including the patient family with the patient consent. Also, you can use the resources like their friends as well as their SMS and so on with permission of the patient. The competency three of the physician is physician are able to share healthcare information plan with patient and their family. That are two. Number one is share information explain that are clear, accurate, and timely while checking for the patient and family understanding. Here, I would emphasize that we have to be very come to at the level of the patient's thinking level. And for example, when I was house officer, one patient complained that this suppository was given by a nurse and asked me to take it, and I'm trying to have it through mouth. So actually, the patient was trying to deglutate, but he was not able to take it. So you have to be very careful that you have to take the clear instructions and disclose harmful patient safety incident to patient and their family. This is very important and accurately and appropriate. The third key competency, fourth competency, the patient physician are able to engage patient and their family in developing plans that reflect patient healthcare and needs and goals. And that can be divided into three that facilitate a discussion, assist patient and their family to identify, access, and make use of information. And also communication technology to support their care and manage their health. And then use communication skill and strategies that help patient and their family make informed decision regarding their health. The fifth competency key is physicians are able to document and share written and electronic information about the medical encounter to optimize clinical making decision, patient safety, confidentiality, and privacy. This is very important that you have to keep the files in such a way that it should be limited to those who are involved in the patient care. So document clinical encounter in accurate, complete, uh, and timely. Communicate with the patient in using written health record, electronic record, and so on. Share information with patient and their and others in a manner that respects patient privacy and confidentiality and enhance understanding. So this was all about communication skill. Now coming to the counseling, this is the second component of our talk. So what is counseling? Lay counselors aim to help patients, to help others and understand their situation more clearly. Number two, identify a range of options for improving the situation. Make choices that fit their values, feelings, and needs. Make their own decision and act, and develop life skills. In counseling, generally, we give them options. These are the various options. And for example, if somebody asks you that should I go for to become a psychiatrist or become a psychologist, so you have to give such an information in a present way, and the cons and pros of both these specialities, and then let him decide or her decide. The three roles of counseling are number one is respect the patient. The counselor should be respectful, he should be responsive, and he should be real. That means generally हमारे यहाँ ये है जो कहते हैं कि हाँ सब ठीक हो जाएगा, सब ठीक नहीं हो सके, हम और आप मिलकर कोशिश करेंगे, अल्लाह मदद करेगा, फिर हो सकता है ये चीज ठीक हो जाए. You should be very careful by selecting words और it's such a way कि वो ये महसूस ना हो कि बस आप सब कुछ आप ही करेंगे, मिलके करें, realistic way में. The counseling ethics and values are acknowledge that clients are unique. Every person is unique. Allow client to freely express feeling. Be aware of the client-counsel relationship and show client acceptance. Show a non-judgmental attitude. Acknowledge that the clients are responsible for themselves. Be aware of your own limitation as a counselor. You are not 100% accurate and you cannot do everything for everyone. So you should have कि नहीं मेरे हर हमेशा 24 घंटे हाजिर हूँ मैं आपके 24 घंटे हाजिर होना मुनासिब नहीं. तो वो आप कहेंगे कि मैं अपने टाइम ऑफिस टाइम में खिदमत हाजिर. Ensure that the confidentiality is maintained. That's very important. Then this is the Egan 3-stage model. Number one stage is exploration. Second is understanding. Third is action. First of all, you have to explore the thing, understand it, and then take action. So goal should be SMART. That SMART means it should be specific, measurable, achievable, realistic, and timely. ये नहीं है कि आपसे कहें कि आपको मैं 2 दिन में आलिम बना दूंगा. उसको कहना होगा कि टाइमली, वक्त लगेगा. The third talk is related to the crisis intervention. The crisis intervention. This is what is a crisis? Crisis, the plural is crisis. It is a Greek word. Is in any unstable and dangerous social situation regarding economic, military, personal, political, or societal affairs, especially one involving an impending abrupt change. More loosely, it is a term meaning a testing time or emergency event. Crisis. So crisis has four defining characteristics. Number one, it should be unexpected, surprise, non-routine thing. It should be, it create uncertainty, kya karna kya. And then seen as a, for example, uncertainty. कि मिसाल के तौर पर कोरोना की वजह से लॉकडाउन होना चाहिए नहीं होना चाहिए, या पाकिस्तान की जो बाउंड्रीज बंद होनी चाहिए थी नहीं होनी चाहिए. And it's seen as a threat to important goal and quality and need for change. So that means कि the crisis unexpected हुआ, फिर uncertainty, और फिर ये कि change चाहिए. So engage in your perspective thinking. Different people see different things in different way. For example, ये जो left corner पे है, people may see it that two people seeing each other closely, while the other person can see कि it's एक गुलदान पड़ा हुआ. On the right side extreme, you can see that there is a lady of 90 years old, but at the same time, you can see that there is a young lady below 30 years of age. So focus on the interest, not position. So therefore, if you look at the crisis, the Greek meaning is decision making, while the Chinese version is it is danger and opportunity, because when you cross the crisis, you can become very experienced and you had the opportunity to tackle that thing. It should be considered as a challenge and opportunity. Crisis intervention is a method of treatment helping patients to cope with crisis in their lives and to learn effective way of dealing in future difficulties. Not only it is for the current situation, but it also for the future difficulties. You might band कर लो कौन है? There are many types of crises. The crisis can be economic crisis, terrorism, political crisis, criminal crisis, personal crisis, and financial crisis, and competitor crisis, accident, natural disaster, and product crisis, legal crisis. These all are various type of crisis. Now, the type of problem can be divided into, it can be related to loss, for example, personal loss, death, or separation. It can be related to health, body part, or organ function, and it can be related to reputation, कि आपका reputation loss हो गया. It can be money and job loss, or it can be a major event like war, earthquake, flood, and road traffic accident. This was related to the loss problem. Then it can be role change. For example, you are having a marriage, so you are having new responsibility, parenthood, new job, added responsibility, and other changes for shifting, transfer, or migration. Relationship problem it can be like parents, friends, parents, child, and friend. These all are various relationship crisis. It can be related to conflict. There's a difficulty in choosing between two undesirable alternatives, or satisfaction on one lead to frustration of other. या आपने एक बच्ची की सारे फीस तो दे दी, दूसरे के लिए प्रॉब्लम हो रहा. The phases of a crisis can be four. Phase one, emotional arousal with effort to solve the problem. Number two, if one fails, greater arousal coupled with distress, resulting in disorganization of the behavior. The person becomes too anxious or angry and is too aroused to sleep properly, so that the fatigue added to their problem. This is the phase two. it means when the phase 1 fails, this greater distress, and then coming to the third phase, that is alternative and novel method of coping are tried. And number 4, continuous effort to resolve the problem lead to a state of progressive exhaustion, deterioration, and decompensation. So this is a vicious circle. The emotional reaction to crisis. What are the various reaction to emotion? It can be numbness, for example, अच्छा ये हो सकता है, फौत हो गया, ये जो है घर मेरा गिर गया, ये earthquake से ही फलां मर गया, numbness. And then fear. Here I want to say कि जब जो रेप के केसेस होते हैं वो इतने नम होते हैं, and the police officer and the other people try to have an interview with them, but actually they are numb, and there can be fearfulness, anger, grief, emotional overactivity, neurotic disposition, and becoming sensitized for future crisis. अब इस सेंसिटाइज पे याद आया कि मुझे हमारे यहाँ हमने एक खातून दाखिल की जो बाद में बहुत बड़े ओहदे पे पहुंच गई। वो इस कदर सेंसिटाइज थी कि थोड़ा सा भी खाकी चीज देखती थी तो वो उसको वो सारी वो कैफे शुरू हो जाती थी जो उसको टॉर्चर के दौरान हुआ था। The coping style can be either maladaptive or adaptive. Maladaptive coping skill include use of alcohol, drugs, and other substance. And then the second can be deliberate self-harm, overdose or self-injury. Then it can be histrionic behavior, cheeky, chilai, shor macha. And then it can be aggressive behavior. These are the maladaptive coping style. The adaptive coping style can be divided as emotional focus or problem focus. The emotional focus are, for example, behavioral and cognitive level, and unconscious defense mechanism. For example, आप इमोशनल किए कि आप वहां से उठ के चले गए, आपने रिफ्रेम किया कि मिसाल के तौर पर अंगूर खटे या ये जो है बेहतर हो कि मैं यहाँ से जाऊं। तो डिफेंस मैकेनिज्म क्या है कि मिसाल के तौर पर एक क्राइसिस में आप आ गए तो उसमें फिर हम डिस्प्लेस कर देते हैं। ये मिसाल के तौर पर ये जो डिफेंस मैकेनिज्म है ये डिनाइल में भी चला जाता है। मिसाल ये नहीं, मुझे नहीं पता। मिसाल के तौर पर एक बंदा है, उसको पता है कि इसको कैंसर है, लेकिन वो बिहेव ऐसे कर रहा है अनकॉन्शियसली, जैसे सिगरेट पी रहा है, क्या क्यों परेशान हो, इस तरीके से। दैट इज डिनाइल। The other can be sublimation or repression, regression. These are all defense mechanisms. The other can be problem focus. Here, in the first emotional focus, you have to reduce your anger, your emotionally depression and anxiety can be reduced. While in the second, that is problem focus, you have to solve the problem. For example, seeking help. Problem solving, you have to do something to remove the problem, and confronting, and then self-medication, self-modification, not medication, modification. You have to change your lifestyle and so on. The emotional focus coping strategy are behavioral strategies. For example, you're watching TV, changing to music and going to sleep or exercise activity, and venting anger for seeking emotional support, avoiding the situation, and at the cognitive level, ignoring the problem, positive reappraisal, and acceptance. The problem focused coping strategy is seeking help from another person, and problem solving can be identify the problem, generate alternative solution, weigh the solution, the cost and benefit, choose one and implement. मिसाल के तौर पर आपको ये है कि आपके यहाँ एक प्रॉब्लम हो गई है कि मकान लेना है या खरीदना है, या कुछ मसला हो गया, बेटा जो है वो जेल में चला गया, तो यू हैव टू चूज वेरियस थिंग्स। कि आया एक तो यही है कि मैं किसी की हेल्प ले लूं, किसी मदद लूं, किसी को लेटर लिखूं चीफ जस्टिस को, उसको लिखूं, दोस्तों से पैसे जमा करूं कि कुछ इनके साथ जो अनबन हो गई वो खत्म हो जाए, और इस तरीके से सारा। Confronting is defending one's own right and persuading another person to change his behavior. This is very difficult. Confronting में ये होता है कि नहीं मैं तो खुद को चेंज नहीं करूंगा, जैसे सास बहू होती है, वो सास के अपनी जगह पे अटकी होती है और बहू अपनी जगह, वो कहती है ये चेंज हो जाए, बजाय उसमें मेरी सजेशन होगी कि जो बहू है उसको चाहिए कि वो चेंज हो, क्योंकि जो सास है उसका तो फ्रेम मजबूत हुआ है। तो कोशिश ये होनी चाहिए कि आप कन्फ्रंटिंग को इस्तेमाल करते हुए ये जरूर रखें कि अगले वाले पे क्या गुजरे। And then self modification and accepting the responsibility, that is controlling your physiological response to stress। मिसाल के तौर पर आपको सांस उखड़ रही है, बेहोश हो रही हैं, चक्कर आ रहे हैं, वो खत्म हो। बायोफीडबैक इज ए मेथड जिसमें एक वो लगाते हैं उंगली पे, जिसमें बायोफीडबैक कान से भी आवाज भी आती है, जिसकी वजह से बंदे के हार्ट रेट और ब्लड प्रेशर नीचे आ जाता है। एंड देन टेंशन, हेडेक, हाई ब्लड प्रेशर and relaxation training, that is deep breathing and so on, and cognitive behavioral therapy, that is you have to change your thinking as well as your action. Why coping fails? There are certain reasons. जब coping strategy हमारी fail क्यों होती है? The problem may be too intense or great, or too many, or too unfamiliar, यानी आपको पता ही नहीं है कि मैं क्या करूं। और जैसे हज के मौके पे अंदाजा नहीं होता है कि मैं किससे राब्ता करूं। खैर अब तो सिस्टम अच्छा हो गया है। The individual has limited coping resources. That means his personality is not well developed. He has physical illness like arthritis है, भाग नहीं सकता, या उस तरीके से हैंडल नहीं कर सकता, या जोर से बोल नहीं सकता, चीख नहीं सकता। Then aging problem and lack of support from family, relatives, friends, colleagues, community, and the government or the state. The crisis में सबसे अहम है, please do not harm. This is the first objective. Crisis situations are volatile, and poor or misleading communication can exacerbate the public fear and increase panic. जैसे हमारे पास एक बार I was sitting in my office in Jinnah Hospital, तो जो इमरजेंसी की इंचार्ज का फोन आया कि एक कारखाने में कई लड़कियां बेहोश हो रही हैं और वो उसको लाया जा रहा है। तो हमें महसूस हुआ कि शायद वो उसको कोई पॉइजन हो गई हो, उससे जो है ऑक्सीजन की कमी की वजह से, या कोई पॉइजनस गैस हो, उस हिसाब से सोच रहे थे। लेकिन जब वो आए पता चला कि वो एक लड़की फौत हो गई थी, लेटरिन में बाथरूम में मुर्दा पाई गई। तो उसके बाद में सारी लड़कियों में एक अजीब सा हो गया कि मुझे भी कुछ हो रहा है, मुझे जिन्न आ गया। तो वो हमने इस तरह से क्राइसिस को कंट्रोल किया कि एक तो वो सारे जो अखबार वाले थे और टीवी वाले थे उनको हटाया कि भाई तुम ऐसे उलट पुलट नहीं दिखाओ, वरना ये जिन जो है जो एक कारखाने में गया दूसरे में चला जाएगा। और फिर जो है उसके घर वाले साथ जो आए थे, जो वो कहते नहीं इनको हाथ नहीं लगाओ, इनको जो है जिन हो गया है। मैंने कहा जिन के लिए भी तो आखिरी 4 कुल आयतुल कुर्सी पढ़ते हैं, मिलके पढ़ते हैं। और इस दौरान में जो बहुत डिस्टर्ब थे उनको इंजेक्शन लगा के फौरन कंट्रोल कर लिया। सिर्फ डॉन अखबार वालों को हमने अलाउ किया कि ये रिस्पॉन्सिबल रिपोर्टिंग करेंगे। तो वो आप इंटरनेट पे डालेंगे तो हम मास हिस्टीरिया हो गया था। और एक हुआ ये था कि एक लड़की जो मुर्दा पाई गई बाथरूम में, उसके कुछ दिन बाद दूसरी लड़की को ने कहा मुझे कुछ नजर आ रहा है, दूसरी ने कहा मुझे भी कुछ नजर आ रहा है, तो सबको वो जिन चढ़ गया था। एनी हाउ दैट इज, उस तरह क्राइसिस को हमने कंट्रोल कर लिया कि अगर हम कंट्रोल ना करते और टीवी पे आता बार बार तो दूसरे कारखानों में भी चला जाता। The conflict resolution is either to come into collision or disagreement by contradiction, or to fight or center do battle, or a fight, battle, or struggle, especially prolonged struggle, Then controversy, that's quarrel and conflict between parties. Fifth can be in the discord of action, feeling and action and effect, antagonism or opposition as of interest and principle, a conflict of idea. This is controversy. And number six, a striking together or coalition. तो coalition में वो करते हैं. What don't work? That is negotiation, mediation, looking at both sides, a win-win attitude अगर हो तो फिर ये चीजें काम करती हैं. वरना अगर conflict हो, hitting हो, walking out हो, naming हो, calling हो, refusing to work or not compromising or not coming to the dialogues, these all are problematic. What is conflict positive? When is conflict positive? When we are able to resolve internal and interpersonal conflict using win-win problem solving, and every relationship will have some conflict at some time or others. When we use win-win problem solving, it is strengthening the relationship, and when we don't, it destroys it. हमें पता होना चाहिए कि किस तरह से conflict को हम resolve करें. What is the owner's responsibility? To find a way to solve the problem, even if he is not the cause of it. वो जब दोनों टेबल पे बैठे हैं तो दोनों पहले तय करना है कि हमने यहाँ से मसले का हल करके ही उठना है और दोनों के ऑब्जेक्टिव हो कि हमने मसले का हल निकालना है. So how to search for win-win situation? Use the power, three responses: fight, flight, avoidance, obedience, shutting down. ये सारे तरीके हैं. एक तो ये कि आपने मसला हल फाइट करके, जनरली फाइट से हल होता नहीं. फिर वहां से उठ के चले गए तो भी मसला करता है, अवॉइड कर रहे हैं, दूर बढ़ रहे हैं. उसके बजाय अगर आप निगोशिएट करें, आइडेंटिफाई ईच अदर्स नीड्स एंड गोल, तो देन मसले का हल निकला है. For that we have to prepare. That include concern and then giving description of the problem that respect all involved and explain how conflict resolution can enable all to win and explain these steps and agree not to slip back to the win-lose method and find a good time and place with no distraction. ये जरूरी है कि आप ऐसे वक्त select करें जिसमें अच्छा time भी हो, peaceful माहौल. Get something to write down ideas. ये भी जरूरी है कि आप अपने ideas को, ये preparation. Then identify the problem issue. Use I message to explain your own concern, needs, and basic. अज़ान को वक्फ. Okay. So first you have to use I message, that I want this instead of we want this, and use reflective listening to hear and acknowledge the other's needs and best goals. Evaluate exactly what each of your actual needs are within the problem. List the needs. Don't accept sudden promises not to cause the problem. So now what are the possible solution? That means think of any or and all possible way to solve the problem so that everyone will have needs met. And evaluate later, not now. You have to evaluate what has been done. Do not criticize any suggestion, feedback with reflective listening, and write down all ideas and suggestions. So what are the how to evaluate the alternative solution? Ask, will it work? Does it meet all the needs of both parties or both all people? Are there any problem likely? And don't accept the solution for the sake of speed. कि नहीं बस जल्दी हाँ हाँ कर दिया. Use reflective listening and I message. Decide on the best solution. Find a solution that is mutually respected to both of you or the other party. If agreement seems difficult, summarize areas of agreement, restate needs, and look for new solution. And make certain that both of you are committed to this solution. For example, husband, wife who are near uh, divorce, so you have to resolve the problem. Implementing the solution, get an agreement on the who does what by when and by when. So you have to कि आज ये फैसला किया, तो आप क्या करेंगे, आप सबकी responsibility. Write this down and check all agreement to it, और अच्छा होगा कि sign ले ले. And refuse to remind or police the solution. So therefore, and I will not suggest कि ये problem police case बना के resolve होते हैं. If you want to set criteria for success, work out these now. Follow-up evaluation. Carry out agreement method. Wait to see if the conflicts seem resolved. If agreement agreed upon solution don't work, remember it is the solution that failed, not the person. जब वो fail हो जाए तो उसका मतलब है कि वो बंदा fail है, उसका आपकी ये action fail हो गया. And जिस तरह से हमारे कहते हैं ये बच्चा अच्छा है या अच्छा नहीं, हम कहते हैं नहीं ओवरऑल ये अच्छा है लेकिन ये आदत ठीक नहीं है कि ये जो शोर कर रहा है. Ask from time to time if the solution is working for both of you. These were the various methods how to resolve problem. If you have any question, I'll be glad to answer. कोई सवाल हो तो you can chat box में डाल सकते हैं या raise hand. We will unmute your mic and you ask. अच्छा होगा आप unmute कर दें mic और then हम उसका जवाब दें. यहाँ मैं ये बताना चाहता हूँ कि हमारे यहाँ बड़ा मसला है कि जब भी वो होते हैं तो फौरन स्ट्राइक या जो है जोर जबरदस्तियां करते हैं, ये बहुत गलत है और उससे मसाइल हल नहीं होने चाहिए, स्ट्राइक तक नौबत नहीं आनी चाहिए और मज़ाकरात ऐसे हों जिसमें ये नहीं हो कि आप अगर जीत भी गए अगला वाला नाराज हो गया, तो ऐसी कामयाबी का ऐसी खुशी यानी अगर आप मुकाबला जीत गए अगला वाला नाराज हो गया तो ऐसी जीत कोई अहमियत नहीं रखती. आखिरत के हिसाब से सब जहन में रखते हुए आपको वो होनी चाहिए. तो चैट बॉक्स को देखते हैं, उसमें एक आया है, सर व्हाट इज द डिफरेंस बिटवीन इकोनॉमिक एंड फाइनेंशियल क्राइसिस. अच्छा, एक तो ये है कि इकोनॉमिक से मुराद है कि जितनी भी इकोनॉमिकल चीज होती हैं रिलेटेड टू फाइनेंस तो सिर्फ पैसों की हद तक है ना, कि जिसमें हम हेल्प करते हैं, लेकिन तकरीबन ये रिलेटेड ही हैं, कोई वो नहीं है, लेकिन ओवरऑल इकोनॉमिक इज ह्यूज टर्म एंड फाइनेंशियल इज वन ऑफ द कंपोनेंट। लेकिन इसमें जिस तरह से जो कई क्राइसिस आ गए दुनिया भर में, ये नहीं हमारे यहाँ तो बड़े क्राइसिस आए हैं, और इस क्राइसिस के दौरान जब रिसोर्सेस इस्तेमाल किए गए सऊदी अरब और उससे जो मदद लिए गए, ये सिर्फ पैसे की हद तक नहीं है, ये हर चीज के हैसियत से है। अगर आपके जहन में कोई और अच्छा वो है तो आप जरूर बताएं। इफ यू हैव एनी गुड। अच्छा, इस इमोशनल रिएक्शन नमनेस मींस, अच्छा इसका मतलब ये होता है कि आप बिल्कुल हवास बाख्ता हो जाते हैं। मैंने देखा है कि एक केस जिसको रैप का केस था, उससे जो इंटरव्यू के लिए किया गया तो बिल्कुल नम थी, ये नहीं बताती नाम क्या है, जिससे हम शॉक में चले जाते हैं। दिस इज वन ऑफ द इमोशनल एक्सप्रेशन, बिल्कुल आप हवास बाख्ता हो गए। आप सवाल माइक के जरिए भी पूछ सकते हैं, हम अनम्यूट कर देंगे, आप अगर वो हैंड शो करेंगे तो विल अनम्यूट यू। असल में ये सारे टॉपिक जो है वो 3-4 उसमें होने चाहिए थे लेक्चर पे, ताकि सीखते ही मिक्स हो गए आप लोगों के साथ। मैं महसूस कर रहा था कि 18.5 मिनट बाद तवज्जो आधी रह जाती है, बीच बीच में हमें थोड़ा सा वक्फा लेना चाहिए। अच्छा, ये सवाल बड़ा अच्छा पूछा, क्या एम्पैथी होने चाहिए पेशेंट के साथ? यस, एम्पैथी तो बहुत जरूरी है, लेकिन इसकी मैं एक मिसाल देता हूँ कि एम्पैथी में यू हैव टू कीप एट द प्लेस ऑफ द पर्सन, उसके शूज में खुद को रखना है, और कि वो कैसा महसूस कर रहे हैं, बट येट मेंटेनिंग योर इंटेग्रिटी। मैं जब इमरजेंसी जिना हॉस्पिटल में काम करता था, तो जब पेशेंट, अक्सर लड़ाइयाँ होती थी, पेशेंट एक्सपायर होता था, तो उससे पहले ही उसको बताते थे, पेशेंट आपका बहुत वो है, आप भी दुआ करें, हम कोशिश भी करते हैं, हम भी दुआ करते हैं। जब पेशेंट एक्सपायर होता था तो ये नहीं था कि उठा के ले जाओ, ये मैं देखता था नर्स कोशिश करती थी कि चादर खींचे और कहते थे डेड बॉडी को उधर ले जाओ, तो मैं कहता नहीं, साइड में करके आओ, हम एक दुआ कर लेते हैं। दुआ करने के बाद इस दौरान मैंने एम्बुलेंस वाले को इंस्ट्रक्शन दी होती कि फौरन आ जाओ, कि रोना धोना जिनास हमारे इमरजेंसी से चले जाए। तो हम जब दुआ कर रहे होते थे तो इस दौरान में वो इमरजेंसी से वो आ जाते थे। तो उसमें ये था कि ये नहीं है कि वो रो रहे हैं तो आप भी रो रहे हैं और इसके साथ ही जा रहे हैं, तो इंटेग्रिटी को बरकरार रखना। और इस पे मैं एक और मिसाल देता हूँ कि पाकिस्तान के अलगुज़े के दुन का खमीसो खान को बुलाया गया तुर्की में, तो तुर्की में पाकिस्तानी म्यूजिक बड़ी मशहूर है, तो पूरे जो सड़क है वो खाली हो गए थे, हर एवरीबडी वाज वेटिंग कि कब ये लाइव प्रोग्राम शुरू होगा। लाइव प्रोग्राम शुरू होता था तो उसके फौरन बाद देखते थे कि वो दीवारें नजर आती थी, नजर नहीं आती, फिर शुरू किया गया, फिर दीवारें नजर आती थी। तीसरी बार के बाद पता चला कि जो कैमरा मैन है, वो जब वो धुन पे नाचने लगते हैं तो कैमरे में उधर उधर हो जाते हैं, फिर ऑटोमेटिक कैमरे बुलाए गए, मंगवाए गए कि ये उस पर फोकस करें, क्योंकि उन लोगों ने कहा कि इस धुन पे हमसे सब्र ही नहीं होता, हम तो उस पर नाच नहीं। तो यहाँ ये जरूरी है कि एम्पैथी के साथ साथ when you keep yourself at the place of the person, you have to maintain your integrity। ये नहीं है कि अपना काम छोड़ के सीएमओ जो है साथ में रोने धोने कब्रिस्तान जा रहा है, अपना काम नहीं छोड़ना चाहिए। ऑल्दो एम्पैथी इज डिफिकल्ट, क्योंकि उसमें आप इसलिए बाज़ औक़ात जो मेंटल हेल्थ प्रोफेशनल को अर्ली रिटायरमेंट भी अलाउ है कुछ मुल्कों में, वो दूसरों की सुनते हैं। एम्पैथी इंसान को अंदर से जो है काफी महसूस, यू हैव टू फील कि ये कैसा महसूस कर रहा है। Is there any question? If there is no question, हम इस दुआ के साथ अपने लेक्चर का अख्तिताम करते हैं कि अल्लाह ताला आप लोगों को इस दुनिया में और आखिरत में कामयाबी दे। और ये सोचें कि जिंदगी में कई इम्तिहानात होते हैं, एक इम्तिहान उनमें से ये भी है, ये जो हम मेडिकल करते हैं, बाकी इम्तिहानात यू हैव टू बिकम अ गुड वाइफ और गुड हस्बैंड और फ्रेंड्स, ब्रदर, सिस्टर और मुआशरे का एक जिम्मेदार शख्स। तो लिहाजा हर सूरत में का वो जो सब्र शुक्र करें, अगर जो अल्लाह ने दिया है उस पर शुक्रगुजार रहें, जो नहीं दिया उस पर सब्र करें। और हमें अल्लाह ताला जो है पाकिस्तान को इकोनॉमिक क्राइसिस से और दूसरी जो मेन डिजास्टर है उनसे बचाए। अस्सलाम वालेकुम।
Thank you, sir. Thank you.
अल्लाह हाफिज। अल्लाह हाफिज।
Allah Hafiz.
Allah Hafiz.
अल्लाह हाफिज।
Thank you, sir.
ओके।